I'd say the majority of our clients come in requiring a detox, and so that is a big part of my job, is to supervise and manage detox medications and try to make it as you know, comfortable as possible for them to come off of their drugs, and usually within a short period of time, within a week or so. So that's a huge part of our job here, and that's where the medical management really comes into play here. I do think it's a benefit. I think it's a benefit to myself because I'm constantly seeing this disease mirrored. So it's actually good for my own recovery, but I think it does help the client when I share a little bit of my personal story when I think it's appropriate. But oftentimes it does sort of put them at peace a little bit, and I can share some experiences of mine when I think it's appropriate and might help them to relate to their own experience. But I know the disease inside and out. I have it, and I know how to, I can recognize it in others. Things really are changing and evolving. I tell clients this, and I think another big role of mine in this setting is as an educational adjunct, trying to inform the patients and their families about the fact that this is a disease, and it oftentimes is hard to convince them. But the evolution that I've seen is when I was in medical school, we really didn't get much training. It really, as I recall, I tell folks I had a one-day-a-week class during my spring semester in my second year. That's changed quite a bit. Today, medical schools get a whole lot more training. There are addiction medicine fellowships that are starting to pop up in academic centers. But I think society in general still has a problem. It has a little difficulty seeing this as a disease. And so that's a very important part of our process here, is trying to educate the patient and the family members as we can. And we have an excellent family program here that does just that. I think it really goes far in educating the family members. But things are evolving. It's not perfect yet.